Okay, I think it's time. I'll call the Neighbors of Dunn County Standing Committee meeting to order here on Thursday, the 22nd. And get going. I think everybody is here and Supervisor Breslin is zooming into us. So we're all
Good
here.
morning.
Hello, Sean. Next up, approval of the minutes. Anybody, I entertain a motion to approve the minutes. Supervisor Keeter, move to approve. Supervisor Witzel, second. Any changes, additions? Doesn't look like it. All in favor of approving the minutes, say aye.
Aye.
They are approved. Next up, is there any public comment, Carmen? Pretty empty. Okay, then, there's nothing at the request of the chair. And number 6, we're right to you immediately.
All right. First, as we start, Quality Assurance Steering Committee, we met 2 weeks ago now. We had a fairly quick meeting. The one thing we did discuss at length, though, was some more changes to COVID policies and things that we are updating due to the end of the public health emergency, which I'll talk a little bit later as well. But our main change is we are changing to do testing on site for staff. I might have talked about this a little bit last month, but we are doing on-site testing for staff if they are calling in sick with symptoms. As the public health emergency has ended, insurance companies, clinics, and pharmacies and places that do COVID testing have required charging for testing now. So insurances aren't covering it. They're no longer free. So staff were having to pay large sums of money to get tested to return to work. So we had developed an in-house plan to do that in a way that we can make sure that they're being done correctly and done in a more systematic way, but still not having our staff have to pay a lot of money to get a COVID test in the community. So that is a change we've implemented now, and it's been going pretty smoothly at this point. We have 7-ish people that are the testers. So people just have to make an appointment to come in and test with one of us just to make sure that they're done correctly by someone who is trained to do the testing. Any questions for QA?
Well,
Yeah, Supervisor Larry Bjork.
thank you, Mr. Chairman. I just had someone tell me yesterday or the day before that the policy that you guys had with people wearing masks extended a lot longer than other places, and they thought that that was a hindrance in people not wanting to wear a mask. I mean, were you guys wearing masks longer than other places?
No, we wore masks until the end of the public health emergency when the policy and the regulation changed, and we took them off about 2 days after that, once we were able to get a in-house policy in place. The only places that have had to wear masks for their households is if we have an outbreak, which is per CMS policy that we are required to have staff bring back masks and wear them again if we have an outbreak of COVID, which we have had one outbreak, which was just a positive staff that a household had to wear them for 14 days. But that is federal CMS standards.
Okay, thank you.
Mm-hmm.
So other places like Mayo or they could have quit wearing masks sooner.
Yes, Mayo did. They have different regulations as a hospital versus a nursing home. So Mayo did take masks away well before we did, but that was because they were able to, we were not. So we followed the nursing home standard. It was about 2 days after we could have taken them away, but we had to create a policy and get it approved through public health and everything. So we did that in a couple of days and then had masks away after that.
Any other questions? All right,
Okay.
6B.
That's the employment activity report. So I believe Chris is on the computer.
I am. Good morning.
Hi, Chris.
Hi. So go through the May employment activity report. The types of recruitment were about the same. I did do another small direct email to potential candidates. That's about the only one different. The other ones are pretty standard month to month. They kind of have that ongoing ad going. Number of direct hire interviews, for agency interviews, for positions offered, for positions accepted, for no one above a step 3. So that usually means that it wasn't any nurses hired. So we did have 4 resignations. A part-time CNA left due to a school schedule. Full-time CNA moved. We had an LTE RN that was doing the in-house COVID testing when we had to be scheduled tested on a more frequent basis. Just her LTE appointment ended. And then a part-time homemaker graduated from college and moved on. So go down to open positions. Those were adjusted with the onboarding and offboarding. Work comp lost hours, another month with no really lost time. And then we go down to missed hours due to COVID, or missed shifts due to COVID for May, about 37 shifts or 296 hours. So kind of a quiet month, which was okay.
Any questions? Yeah, I don't, Supervisor Keeter.
Yeah, I was just wondering, in red here, it says 23 positions filled with agency CNAs is
Correct.
this past month. Now, do CNAs rather work for an agency than, it looks like the agency has plenty of CNAs, or don't they either?
So a lot of our agency CNAs are not from local areas. So most of them come from the southern part of the country. So a lot of our CNAs are from Alabama, Mississippi.
Oh, okay.
So they're not local CNAs.
Anybody else? Sean? No.
Nope.
I don't envy you, Chris, or trying to hire people.
No.
We just got a large little postcard in the mail from Synergy.
Mhm.
And they mailed that. That's got to be expensive looking for jobs. Just, it's interesting. Someone told me that a couple people involved with, I think it's West Cap, got their CNA certificates just recently.
Awesome.
So, I hope they come over here.
Mhm.
Thank you.
Yeah, advertising is expensive. I think the last time I did a newspaper ad, help wanted ad, it was probably approaching $900 for a small ad. It's pretty high to advertise like that.
Where was that, Chris?
That would have been through the Eau Claire Leader.
Okay.
So
I wonder how much the Colfax Messenger would cost.
I want to say they're a little bit cheaper. Just the coverage is less. You get more coverage with the Eau Claire Leader, but I don't ever get any. The employment market, that age group doesn't read the newspapers anymore, so it's kind of a waste of money to do that. So
I've got a question.
Yes, Supervisor Witzel.
Okay, so you say they come from the southern states like Alabama, do these people live here? They come up here from them temp agencies, or how does?
Yep. So how that works is that they are hired through a temp agency. So we use agency contracts basically, and we contact the agency, say we have open shifts, do you have people, or open positions, do you have people to fill them? They then send us application kind of things. We interview them, so we don't just accept anybody that they send. And then they come and they typically live in hotels or short-term rentals. Sometimes they find like Airbnb kind of stuff. They might live together. Frequently it's hotels, long stay hotels. And then their agency pays them a stipend for that. And that is part of why they are more expensive for us to pay, is their stipend to live up here.
So the closest you can get is those southern states. There's nothing in between that you can hire.
So
States like from Iowa or Michigan or Illinois or whatever, there's nothing in between to hire.
sometimes they are from those other states in between. It's just the majority are from there. The agencies that we use 2 right now, and they both actually are based in Nebraska. So they're not directly from those states. So then they reach out to people all over the country, people sign up with them, and then they come. So we don't necessarily know where they're coming from before they get to us.
Great, thank you. Well, let's then. Are we down to C?
Yep. All right, CNA training program. So my only update on this is that I did talk with the person from the company that we are working with about a week and a half ago. And she did tell me that she has 2 instructors that are willing to come to Menominee. So we're working with sending more up specific measurements of the space. She thinks that it worked out that we could use the space in Arrowhead as we have no plans of filling it at this time, considering our next place to fill would be Fireside. And I did explain to her that last month at this committee meeting, we discussed budgeting for that household to be closed. So that's a more specific, we don't really have active plans of filling that. And they were more accepting of that since even though they are still licensed beds, that we have a clear statement of based on budgeting that we have no plans to fill those beds at this time. So we're moving forward with Arrowhead being the option and the classroom. And then she did say she has 2 teachers that would be interested in coming to Menominee. So that's one of the biggest hurdles is finding instructors. So that's really good news. But still working on that.
Any questions?
Do we know where they're coming from? I mean, like states or?
Yeah,
Sorry. Do we know if they're coming like from close by, states further away or?
The instructors would be local, so they'd
Okay.
be employed by a local company.
Okay.
okay, it looks like 6D.
Resident referral report, so it is on the back of your employment report. So we started the month with 99 residents. We had 74 referrals. So we're a little bit more averaging out how we used to be in the below 100, a little bit higher than pre-COVID numbers, but not in the 120s to 150s like it had been for a while. We had 7 residents admitted to the neighbors this month, and we had 67 not admitted. Ended the month at 101. We had 1 person transfer to another facility. We had 1 death, and then we had 7 discharges. And our current census, we're hovering right around 100, but as of today, we have 96. And then we have 3 admits over the next day and a day or 2. So we'll be right around 100. Lots of ins and outs. Our admissions team has been working really hard. We've had lots of short-term stays recently and filling beds as soon as they come open for the ones that we have open at this time. We still do have the 2 households closed.
Supervisor Bjork.
Thank you, Mr. Chairman. The new admits, are those more than likely people that have been on a waiting list? Or how do you prioritize, how do you?
So it depends. So if we have a referral for a short-term stay, we look at those first. So those are people coming in from the hospital. If we have a bed that's open for a long-term stay, then we would call down the waiting list first. And it kind of depends on what waiting list they're on. If we have someone that's specifically on a waiting list for memory care, if there's a memory care bed, we'll call those people first. And then if it's someone that's just on the waiting list for long-term care in general, we start there. Frequently, people will put themselves on the waiting list years before they ever need nursing home care, just so that they're on the list so that when they do need it. So we'll start at the top, call them, and they'll be like, oh, we're not ready yet, and then go to the next person kind of thing.
That's interesting. Thank you.
I see 7 are discharged to home. Are these rehab people? Are we?
We've had an increased rehab population over the past couple of months. So we are admitting rehab people to the other households, even though Fireside and Arrowhead are closed. We are still duly licensed for all 137 beds, so we can have Medicare stays in any bed. So we are having more rehab people at this time, so which is a good thing, as Medicare is one of the highest paying sources as well. So if we're going to have less people, at least we're having people that are we're getting higher reimbursement for.
I noticed, I don't know if it was at our meeting last night. Are we planning on in 2024 opening up one of the closed ones?
Yes, so that was, as we discussed last
Okay.
month on the budget, that we are gonna have, our plan for the budget is to have one household, budgeted closed. This past year, we had budgeted fully open, so we thought having one household closed and one open would be the in-between of that, and hopefully we will open Fireside. We won't, it's not guaranteed that it would be the beginning of 2024. Maybe we would open it this year, maybe partially through the year, but planning to have it open if we can.
I assume it all depends on staff.
Correct.
Okay. You guys aren't doubling up and cloning or anything?
I wish we could.
Okay. Thank you. Any other questions on 6D resident referral report? Okay. Now we get to go to Scott on 6E.
Good morning, everyone. Things have been going quite well for the facilities department. The guys have been working on their work orders, their preventive maintenance and repairing any equipment. I'm still working on the door lock quotes for the card readers to see where we're at on that, and still also working on the bids for the bus. I know Brady's been working on some of the cooling for the kitchen. There's some issues with the units on the roof, so he's been working on that, and we've got a plan for that. So things are going along quite smoothly, actually.
Oh, that's really great. I'm curious about the badges, the entry. Will everybody get them? Like Carmen's not in this building. Will Carmen get one? Will Jane get one? Will the supervisors get one? How's that gonna work?
So it would work as you would be issued a name badge, like mine, every employee would. And that badge gives you access to certain doors. So for instance, Carmen would have access to all the doors at the neighbors. She would have limited access to doors in this building.
Gotcha. I'm just curious. Thank you. That's your shortest report ever, and it sounds good. Nice call. Great, thank you.
Thanks.
All right, 6F, Medicaid rate appeals update.
All right, so I've got a couple of updates regarding Medicaid rates. Some of it's regarding the appeals and some of it is just kind of general updates about Medicaid rates. So as you're all aware, we did appeal our Medicaid rates. We went through the process of that. At this point, we're just waiting to hear back from the ALJ judge and just hear their opinion. So we got basically the motion to dismiss from the state's attorney. We responded to that motion to dismiss, and then they responded to our response, which is kind of the end of the process. And then we just wait to hear from the ALJ judge, which we haven't yet. So just kind of waiting on that. I'm not holding my breath. I don't believe any other facilities have, if they've heard back, it has just been dismissed. And if not, they haven't heard anything yet. So, but the good news is that our rates have kind of settled down a little bit, which Jane will talk a little bit more about later, that they are looking a little bit better. We aren't as off of what we had projected as what we were thinking we were. And then on top of that, some general good news about Medicaid rates. Last week, the Joint Finance Committee met and discussed, that was their meeting for health-related services and basically working on the budget for the governor. And we came out very well for that for nursing homes. Actually, long-term care in general came out very, very well from the Joint Finance Committee's recommendations. Granted, that is not set in stone until the budget is actually signed by the governor. So things could change, but it's a really positive step. So they signed to have more of a payment standard. So as if you've been on the board for a while, are aware, we always have that arguing for rates issue, basically. So it's always been on our legislative agenda that we advocate for a higher percentage increase and just more increases and more increases based on percentages. And then it's kind of like, well, this year we get a 2%, this year we get a 5%, whatever it might be. So what the Joint Finance Committee has done, which was was a proposal from a bunch of the associations and things like that, was to set an actual payment standard. So we will no longer have to argue for rates. So it'll be based on the median facility cost plus 25%. So basically that means whatever the middle facility cost is when they average out all facilities, and then plus 25% will be the standard for Medicaid rates. That is a huge improvement because that means as our costs go up, the rates will go up instead of our costs going up and then after the fact asking for higher rates. So it'll take some time to have more of an actual effect, but it's a really, really good thing going forward. So we were quite excited about that last week when we heard that that was in the final Joint Finance Committee recommendation. In addition to that, which is also super positive for us, in previous years, the incentive to have a small facility, which is why we have 3 facilities, is there's a $5 a day incentive for Medicaid beds for facilities that are under 50 beds. That it was the idea of taking one very large building and making 3 smaller buildings was to get that incentive. In the past few years, it has actually not really benefited much based on how the rates are calculated. It's part of an inclusion and the limits and lots of very in the weeds details, but basically it has not been beneficial at this point. They also voted to basically pull those out so that it's on top of the other rates now, so it actually will be beneficial again. So that's another big positive for us as well. So some good news in regarding state budgeting. Any questions on that at all?
Supervisor Keeter.
Would this, if it does go through, would this affect this year's budget? Or is it next year? See, the budget will be passed sometime in the next couple of months, I think.
Correct.
So then will that take effect right away, this 25%?
It would fall into the rates that would be back paid for that part of the year. So that's the hard part. So the budget would be signed it's supposed to be signed before July 1 because the state fiscal year starts July 1st. Whether that happens or not is still a question mark. Because at this point, once Joint Finance Committee, it completes the budget, it would go to the governor, and then the governor has a chance to veto and all of those things. And considering it is June 22nd, that's quite a short time frame. But just like if you remember last year, we got our rates and things for July in December. Kind of, we got interim rates, so it would benefit this year if they get it done in time for this year kind of thing. So hopefully, but it all depends on timing of cost report reviews and rate setting and all of that, but it should benefit this year for the second half of the year.
Yeah, I hadn't thought of that. That's a great question.
Mhm.
And you answered that in a very interesting way.
It should benefit this year.
Okay, anything else on that? Well, I'm really glad that the COVID doesn't take a top spot anymore.
Nope, no longer at the top.
6G.
Yep, that
Yep.
was the Medicaid rates.
Yep. Did you have a question on any of them? though?
Oh, you're on the minutes.
Okay.
That was from last month. There you go.
Disaster Joe was not a disaster.
Wait, there wasn't a meeting, so I was waiting to hear about that. Or was I here? Let's not make it.
Yeah, okay. Yeah, COVID-19. Yes,
Okay. So we talked about this a little bit before, but my only other update would be that we did have 3 positive staff this past month, just isolated incidents of people being positive. And so we had staff out for a little bit. And then we did have to have one household and then a couple other staff that had contact with staff members wear masks for 14 days. It went fairly smoothly. We communicated with our staff before we removed masks that was going to be the expectation, and it's required by CMS that if we do have an outbreak, we do have to wear masks again. We were a little bit nervous of once we take them away, telling people to put them back on was going to be really difficult. But it went pretty well and people understood, and we had that communication out for quite some time and retelling people this is what it's going to be. Like, it's great we don't have to have them for now, but there might be a time that we have to have them again, and it went fairly smoothly, I think. So we did not have any positive residents though. So, and we are still running outbreaks, that it is still part of CMS. So if we have one positive staff member, whatever household that or area that they worked in, those individuals would have to be tested weekly for 14 days, which we did, and there was no positives. So.
Wow.
Any questions on COVID?
And no, I guess there aren't. 6H 2024 private pay rate.
Okay, so this is a discussion item that I am looking for some input on. So as Jane and I are preparing the 2024 budget, one of the questions is what we would like to have as a private pay rate. In the past, we have done a pretty much standard 2 to 4% increase. So it's been pretty much based on inflation rates for increasing our private pay rate. That has kind of gotten us behind the bell curve right now. Our Medicaid rates are actually higher than our private pay rates currently, which I never thought I'd hear those words or say those words. But so we've looked at a couple of different options of what we want to increase and looking for some opinions on that. The hard part is it does increase the cost to the people that are living with us that are paying by themselves. And then subsequently that will also then just have people get to Medicaid sooner. It's kind of a horse piece kind of thing. We don't want to shortchange ourselves for the care we're providing now, but it will also cost some, and it is also a PR thing as well, how much we are charging people to live there. So our current rate is at $298 for a day for a private pay resident. So that is a room and board rate. So that is basically to live there. It covers staffing, it covers food, all the utilities. Basically that's rent. So that does not include medications. It does not include any sort of added treatment. Incontinence products, things like that would then be charged out as well. So it's not an all-encompassed rate. The only rate that we get that is all encumbered is Medicare and VA. So those ones are everything, but like Medicaid and all of that stuff, there's other charges on it as well. So our historic rate increase was 2%. So that would get us to 304 as a daily rate. 4% would be 310. 8% would be 321, which 8% is the current inflation rate and has been for the last year or two. And then 10% would be 328. So I don't think we would go up to 10%. That would get us closer to, that would be basically our Medicaid rates. A 10% increase is a lot. And that's a lot of money, asking people to pay a 10% increase on that high of a daily rate anyways. My thought would be to do a 8% increase, considering that is what inflation rates have been consistently. And we can directly tie that back to simply our food costs have gone up 8%. That's a really easy one to look at, that this is the cost. It's the same per day for every resident. Because when we go into medications and medical supplies and things, those are different for everybody. But food, we make the same food basically for everybody every day. And our food costs have gone up 8%. So that alone has increased that much. And that being said, we didn't increase it by that much this past year, and we've been kind of eating that inflation cost for 2023, as we only went up the standard 2% that we had previously done based on past inflation rates. So I'm wondering if anyone has thoughts on that. I thought it would be best to get some committee input on this for we should do for private pay rates.
Supervisor Keeter.
I was just wondering, over the past 10 years, it's always been about 2% every year.
Roughly, there's been a couple years that we did, I believe there's one we did 4%. There was a year we actually decreased it. That was, it was before I started. So I think it was probably around like 2016, 2015. We were charging more than the other facilities around, which is something that's a weird thing that you can't ask. You cannot ask other facilities rates. It's part of agreements with associations and stuff. But they do come out on some reports and things like that. So at that point, we had actually decreased our rates. But since in the last 5 years, we've gone up about 2 to 4% every year.
That's what I was going to ask you. If, you know, say American Lutheran Homes, so you don't really know that. Can you kind of figure it out a little bit? What they might be charging, or?
We can figure it out based on, they come out with county averages. So we could figure it out now based on it's just us and them in the county
Okay.
and do the math. So when it comes out, we could figure it out. We cannot ask.
Okay. Do you think we're pretty competitive with them, or?
I would say we have been competitive with them. I would say every facility is pretty similar. I don't know about how other facilities have done higher increases in the past couple of years. But I do know also so for example, like a for-profit facility, and ALH is not a for-profit facility, but I'm sure the for-profits are doing full increases because they got to cover their costs. It's no different than how when you go to the grocery store, everything is more expensive now. So it's more expensive for us to provide the care. And right now, without the increase, we're eating that inflation cost versus the consumer having it. I do also have numbers of how much each of these percentages would affect our budget based on the number of private pay people we have per day. So if we were not to change anything at all, if we stayed at 298, which I don't believe we do, obviously that wouldn't increase any dollar amounts for this year. If we were to increase 298 by 2% at that 304, we would go up by $25,612. If we were to increase by 4%, it would be $51,225. 8% would be $98,181. And then the 10% would be $127,209. So that's the annual budget impact for all of those increases based on next year's numbers.
Do you see the inflation rate staying at 8%? I mean, I work in produce and I know what our rates are going up here last month. It's been closer to 15%. So wouldn't we be better off going with the 10% just so we didn't get in the same spot next year?
Sure. So a few different things have gone up by different percentages. So what we've seen for our food is it stayed at 8% right now. We did just do our food budget for 2024. And we had our Dave from our kitchen, he had contacted our suppliers and they had said that it was going to be about 8.5 based on what we order. I'm assuming produce is going up higher than like frozen food and things like that, which is a lot of ours. So they anticipated about 8-ish% is what he had said actually just yesterday. And then other medical supplies and stuff have been a little below that 8-ish% is what we've seen. We've also tried to adjust some purchasing to not have as high of cost by using slightly cheaper products and things like that as well. So the 8 was kind of our average of the different things altogether. And then the actual federal inflation rate right now, I think is at around 5% is what
Yeah.
we had looked at. So that would be other things too, as well as staffing. I'm not sure if this was brought up at county board last night as I wasn't able to attend, but I know that the staffing increase right now in the budget is projected for 4%. So that would be in between as well.
All right. Thank you.
Thank you for chiming in, Supervisor Breslin. Yes, sir. So, and I'm only calling on you so that people listening to this and on YouTube know who's talking.
Thank you,
Yeah.
Mr. Chairman. Well, I think our greatest need for the Dunn County neighbors, healthcare center, neighbors of Dunn County, is that we need to convince the public and other board members that this is an important thing to have in Dunn County. And I'd like to be able to say that we are keeping up with inflation by just increasing the percentages that we're talking about will be another $100,000, and that we are frugal, but we're not charity. And I'd like it to stay the same, but I think we got, to me, I have to approach it with, when I talk to somebody that says they're gonna lose how much money, that at least I got a little something to talk about. And one of those would be that it's costing more to be there. And that might help with the deficits. So that's the way I see it. 8% would be fine with me, 10 would be okay also.
I like that. Frugal, but not charity. I like that. Supervisor Keeter.
Yeah, I think, as long as we know we're gonna have a budget deficit, we probably need to do everything we can to reduce that. And I suspect at least a certain percentage of the private pay have long-term care insurance, which helps.
They do, some do. It depends on the plan. Some are very helpful plans and some
Okay.
don't pay for very much. It really depends on what plan they purchase, but we
Okay.
do have a couple of those.
Okay. Yeah, I think too, like you said, we can't really be a charity either, So I guess I'd go with your recommendation.
Supervisor Witzel.
Yeah, I was gonna say too, being that you mentioned the 8-ish, inflation rate and stuff, I think we can't, I don't think we should go below that.
Yeah.
I think we need to stay there, and if we can go to 10 would even be better,
Mhm.
so that we have something to work with that,
Mhm. And then, if inflation does really drop down to 2%, which the Federal Reserve wants to do next year, then maybe you wouldn't have to increase at all. That's a possibility.
Double digit always sounds more, doesn't it? 10 versus 9.5.
Yeah.
Yeah.
Yeah, that's true.
But
Yeah, we could do it doesn't have to be full percentages either. We could do a 9.5 if that, I mean, I agree, 10% just sounds like a lot. And I completely agree with all of the not giving it anything away for free kind of thing. I'm a little bit nervous about public recourse after of a 10% increase.
Mhm.
so it seems, you guys can correct me, it seems like the committee feels you can go with an increase like we recommended or even larger. We would have no problem with 10 or less.
Okay.
Is that Sean?
Yeah, I'd like to go as, 10 does sound just bigger. 9.5, if we could do that as high as we can get, just so we can try to offset some of the deficit and still prepare for whatever's coming down next year. And yes, the Federal Reserve's trying to get inflation down, but we don't know if they're actually going to be able to do it.
So does that give you some direction, and then you
Yes,
guys
thank
use
you.
your expertise? Yeah, thank you, everybody. That's great. Oh, are you done?
I did have one other thing that I didn't include on here, but it's minor. And it's just an ask for the committee. So yesterday I met with a few other department heads and people from the county on the county picnic. We've been talking about that, and they asked all anyone from that was in the meeting to ask their committees. And we had a different idea this year of trying to get more staff involved and more staff coming. As for an example, NDC is one of the bigger departments in the county, and I think we had about 5 people at the picnic last year. So we're trying to get more people involved, more people here. So we're actually planning on hosting it here at the government center instead of at the park downtown, to have it right by where people are working so that they could come over from the 24-hour operations, that they could come right after work if they end at 4:30, things like that. One of the ideas that we had was having county board supervisors as helping with serving and greeting and doing things with staff. So that was something that they wanted us to bring up at our committees, that if you are interested in that, please let us know. You can let me know, or Jenna is also kind of heading that picnic committee. Just as a thank you to staff, is part of what the picnic is. So thinking of getting a little bit more county board involvement would be beneficial and be good with staff as well. So if you're interested in that, please let me know.
Sean, it sounds like,
What's the date of the county picnic?
So the date is August 10th. Is the day we settled on. It's a Thursday, and it'll
Okay.
be from 2 to 6. So it's a longer time frame. We used to do it at 4:30, 5 o'clock over at Wakanda Park. And we're trying to make it a little bit more inclusive of all staff, because 24-hour operations couldn't go. So the neighbors, highway, or not highway, the jail, highways sometimes as well, but the sheriff's office. So even if it's just helping for a little bit, we'd greatly appreciate it. The department heads are doing so as well.
Yeah, I'd be open to coming in and helping.
Awesome. Thank you.
Yep.
And now, more information and a flyer that'll actually be announcing this. It hasn't been fully announced to the county staff yet, what day it is and things like that. A flyer will be coming out shortly, probably in the next week, just saying like a save the date kind of thing. But since we had this committee today, I thought I'd bring it up now.
Yeah.
Okay.
yeah, I will too.
Besides that, that concludes my report, unless there's any other questions for me at all.
No questions?
All right, thank you.
Okay. Number 7, consideration for action to be taken by the committee. Review of vouchers and financial reports. Jane, is that you?
Yes, that is me. Good morning, everybody. The way I printed my packet, the vouchers are in the back. Are there any questions on the vouchers? No? Okay. Then let's work our way back. We usually do the aging map or graph next. And the campus census. So the aging summary shows on the very right-hand bar a little bit less in blue and a little bit more in orange. The orange is representative of our Medicare A billing cycle, which we have to wait for a month and then bill it all out. So that is actually a little bit of a good sign, saying that our Medicare is increasing. The big green part is usually a bad thing. But that is, then, yeah, because that's the older aging that hasn't been collected yet. But that is representative of the Medicaid rate adjustments that are now posted into our software and lead into this graph. So that is obviously from last July, August, September and forward. So that is older debt, and that shows up in that green bar. So does that make sense? Okay. And as we increase our census a little bit, that number, of course, is going to get a little bit higher. So, but I think it's all going well on that front.
Can I just ask for a summary to make sure I understand it? So starting with the current and then 31 to 60 and 68 to 90. The more current it is, the bigger the bar should be, and the longer away it is, the smaller the bar.
Right,
portion
we
be.
should be collecting our money and it shouldn't be sitting out there for
Okay.
6 to 8 months.
Okay, and so they should all be nice and smooth, but they're not because of all the different ways they get collected and, okay.
True.
Okay, I just want to make sure I get it.
Yeah.
Thank you, Jane.
And then the rates changed retroactively, so that's reflected there. Yep. On the campus census, the good news there is the that little orange bar at 422, that's our Medicare A census for May, which hit the target from our budget, which is great news. And Medicare rates as they're going up, or Medicaid rates as they're going up, is good because we do have a lot of that payer source in our census. So that's good news too. It's a healthy and stable census mix. Okay, then to the detail of the financials. With the little blue bars across the top. And it's labeled page 1 of 5. Let's start with the top graph, or the top detail, where it's the overall. It says the neighbors of Dunn County, January through May. Compared to last month, there are some changes in our projections. As we know more from the state on the intergovernmental and the Medicaid rates, we're able to change our projections. So the intergovernmental has gone down. We are projecting 300,000 less in that because that's what the state tells us, is that we're getting paid more upfront. So then the reimbursement on the backside, we're not short as much. So that makes sense.
Just for reference, intergovernmental is the supplemental payment. So when you hear us talk about supplemental payment in SAP, it's called intergovernmental.
Okay.
Yeah. So the state is able to work with county homes and fill in the gap of our shortfalls. So if the rates are higher to start with, their shortfalls would be less, and that's reflected here. The public charges, that's our room and board, and for all pay sources. And that we are reflecting as an increase over last month of $500,000. So again, that reflects the Medicaid rates and what they've finally told us after, round 4 of what they've told us. That's what we're settling on. And I think that's the final answer from the state. So that's the good news, that our revenues there are up by $500,000. The miscellaneous revenues are the senior meals, and that's pretty stable every month. It's pretty much designed to be a break-even endeavor, not to overcharge the ADRC for those senior meals. And that's how it's working. Carmen, you want to say something?
I was just going to add that we did also just do our budget for senior meals, and we are planning on keeping the same margin basically of charging them basically what it costs us. So we are continuing that contract in 2024, and we're just working on redoing the contract with a different rate to do the same inflation adjustments as well.
Yep. Interest would be interest on old accounts that we can charge. That's a fluctuating number. It's small, but it encourages people to pay their bills. Not to be a moneymaker, but it does encourage prompt payment. The donations revenue is estimated to be the, the bus money. And I'm sorry, I don't have today's amount. It's similar to last month. We have had one fundraiser, which brought in I can't remember, $500, $600.
Yeah, normally the lunch sales are around $500.
So that's still looking good. Salary and fringe has been, we did some fine tuning on that one and looked at some more detail. That estimation has gone down by $200,000 from last month's projection. So the salary and fringe from the hired staff, not the agency staff, but that is a lower projection at this point. The agency staff, we have projected that as well at a decrease of $400,000 from last month's projection based on trends and settling into, we're not increasing our agency staff use that I can see. It's stable and so we haven't estimated based on an increase, we've estimated at a stable rate. Does that make sense to you? And the operating expenses are pretty much on track and are below our budgeted amount. If you look at the kind of middle column, total 2023 budget. So our operating expenses were budgeted at 3.5 million and we're coming in at an estimate of 3.2. So because our census is lower than we projected, so are the operating expenses. And then depreciation and CIP, we did delete a couple things out of that. That Scott mentioned at the last meeting, they're not planning on doing the trim work in each building. So we took that out of our estimated expense as well. Which leaves us with revenue of 12.98 million, expenses estimated at 15.8, and a net loss of 2.9 before inflation or before depreciation. And then the net without depreciation, that's the number we all look forward to, is 2.233 million, where last month it was $3.02. So that has come down quite a bit, our estimations when we did the fine tuning and when Medicaid gave us our final rates. So that's the good news. We're not losing so much. And then things still can change. It's all still very fluid. The labor market is fluid. Like we discussed earlier, the Medicaid rates that start in July next month, we won't know about until maybe September, October, November, and they don't actually pay them out probably until December-ish. So that's still up in the air. We expect an increase there.
As well as we did do Chris Corpola and asked and looked into doing kind of a deep dive of where we were at this point in previous years. And even in years that we have come out in the black at the end of the year, we've pretty much consistently been at this point projecting this kind of loss at this point. So even last year, so it kind of doesn't tell us much, but it's not as doom and gloom as because we have had years that we've ended up with significantly in the black when we've also been at a loss at this point in the year. So it's still potential that projection could be true, could be there, but it also has possibility of being less than that as well, because that has been the historic.
Right. This is a conservative estimate.
Yep.
We don't want to say that we are doing much better and then have a big surprise at the end. So, but this is, I believe it's rational and reasonable projecting.
Yep. We'd rather have positive surprises than negative surprises. Yep.
So is that kind of like always expect the worst, but you'd be surprised maybe?
Yeah.
Yeah.
Okay.
And
So if you follow the change in projection to each neighborhood, the east neighborhood, well, they have different Medicaid rates too, and different expenses for each building. So say east is better by $500,000. West is doing better by 380,000, and central kind of went down as far as their projection. So it balances out. It's nice to look at the campus as a whole, which is that gives you a bigger overall picture. Any questions on any of those line items there?
Thank you for going through them.
It-
It's always nice.
You're welcome. Then if you have any other questions later on the differences, please ask. Agency staff financial report. I just look at the grand total. It is detailed on page 3 of 5. It's detailed by CNA, RN, and LPN. And also then the grand total is the piece we like to look at. The year-to-date actual is $2,152,000 for total agency staff expense. And we're projecting, like I said, that's projected down. So it's not going up. That's a good thing. So the hiring process is stabilizing, at least to a point where we're not using more. But that is still very fluid. Some of that projection depends on when the invoices are posted. We try to get as much detail on that as we can before we make this projection. But that's as close as we can get right now. We're continuing to monitor the number of hours versus the cost, and make sure that we're tracking month to month. Then
Could you said tracking the number of hours versus the cost. Could you explain that a little bit, please?
the number of hours of agency staff for each building to ensure that each building is actually getting coded to the right staff. I mean, if we have east at like so many hours, we're actually posting our expenses to the right thing, and they actually match up. We're auditing that a little bit more so we can fine tune and make better estimates. It's pretty good. I mean, there's no big mistakes or errors, but it's nice to prove that we're doing it all right from the start.
That's primarily for cost reporting purposes.
Yeah. And just to kind of self-audit that that we know that it all makes sense and that the numbers are true. And then the overall at the bottom of that page 3 of 5, well, that's the nursing staff, excuse me, that's not the overall. That next chart is the hired staff, estimated cost of $5 million. So together, if we,
No, wait, these are the non-agency.
Yeah.
non-agency,
And it's not just nursing. It's
That's just nursing and
just the nursing staff. So like
Okay.
Carmen's salary and social worker and dietary is separate.
okay. Does that include CNAs? and-
Yes.
Okay, that does include
Yep.
CNA. Okay,
nursing department. So anyone that would fall under nursing's costs.
Homemakers.
thank you.
So we turn over to page 4 or 5. That's the total nursing expense when you combine the agency staff, the nursing direct hired staff. We budgeted for 9.4. That's the third numerical column over, and we're at 10 million as a projection. So that is a higher labor estimate than we budgeted for. Because when you budget in May and June for the following year, you don't always know the future. So that's still close to the budget.
And going back to what we talked about as far as budgeting for the full, everything open. So when we budgeted for 2023, that 9.4 million, is that for assuming everything was open?
Correct.
Okay,
Yep.
so
And the projected is for like 7 nights. So actually cost per person per day is higher.
Okay,
Yeah.
thank you.
Moving on to page 5, the senior meals we track. That's on schedule. We're not losing money. There's a little bit, it shows a little bit of positive there, which does cover some other overhead that doesn't make it into the SAP module here. So in the end, it's a net wash. And depreciation is there. It's a non-cash item, but in our audits, it does get included as an expense. That is the end of the financial report. Any other questions or concerns or requests for different information?
Supervisor Breslin or anybody here?
I was just wondering, on the senior meals, it looks like we're losing some money there. 34,000.
Well, depending on which one we look at, the negatives, the numbers in parentheses could be a positive number.
Well, that's, okay,
Yeah.
we're getting back to the parentheses again.
Yeah.
Yes, yeah.
So.
If you
it's-
look at the revenue, it's 165,000, and then right below it is the expense is 131. So that's
Oh,
a
okay.
positive.
So the 34,000 is actually a profit then.
Correct.
Okay.
And in some other places, the parentheses are negative if it's a total, right?
That's
So,
correct.
yeah.
That's correct. So I always go back and look at the word where the revenue word is and the expense word and make sure I'm tracking it correctly.
Okay, it looks like you did a great job explaining. No other questions. Then I would accept the motion where we are accepting the vouchers and financial reports.
I so motion.
And Supervisor Witzel and Supervisor Breslin, first and second. Any other discussion? All in favor?
Aye.
Passed. Next.
I gotta go to Grant.
Oh, okay, yep, great. Don't, any deer on the way down there?
No.
Okay. Yeah, thanks for coming.
In the
You,
olden days, us 18-year-olds would try to set land speed records from saloon in Menominee to a saloon in Durant, but I'm not doing that today.
I'm really glad that you're speaking to Don right now. Yeah, I'm glad you came, Larry. That was good. Yeah.
Thank you.
Next meeting time and date, please.
July 27th, 9 a.m.
Okay, now I have a question. Let's take a day off in the summer. Let's skip a meeting.
Okay,
August or July.
I can look at what the August date is. It's
Does it-
either-
July is the county fair. That matters.
Yeah. That's fair week, so maybe July.
Let's skip July.
Okay.
You don't mind not coming, sir?
I'll be at the fair.
But you can be here.
Yeah.
Don, is that okay? Sean, any problem skipping July? Okay,
Okay with me.
okay. We won't tell Larry.
Mhm.
No, we won't.
At some point, we'll have an auditor's report, so we should schedule that for August then.
Okay, that
Okay.
sounds good. And that works out for you too then? And we
Okay.
don't actually have to pay okay bills. You pay them anyway.
Yep,
Yeah,
we
okay.
pay them anyways. So then the next meeting would be August 24th.
Okay. And great. Anybody else? Anything? We are adjourned.
Have a good day, everyone.
You too, Sean. Thanks for zooming in.